Hello, good afternoon, everyone. Welcome to another Ask Me Anything up for the public. This week, we are going to be talking about safety planning in unpredictable environments. This is important because we have all seen the recent news stories about some CDCs are closing. We have some families that are worried about CDCs closing. I know that PCS season is coming up. And so we're seeing a lot of families shift into new care options that they haven't had to really navigate before. And while safety planning is not new, this is something that we've done as an organization for some time, and you usually do see it more in harm reduction areas. We're going to be really focusing in on how you can safety plan your situations yourselves, or you can always come in to our case management if you need to. Primarily, what we want to be looking at as we are moving into this kind of unpredictable situation is focusing on the perfect option could leave you without any options. And so sometimes we need to look at what is safe first and then move into our longer term goals. So we're going to go over some things related to that today. Today, you have some familiar faces here. We have Sabrina Dalton, who is case manager. So if you've come into our case management in the last 6 or 7 months, you have engaged with her. And then we have Maria Quinn, a childcare advocate, and also our subject matter expert on all things non-traditional care. So let's dive in. I'll get us started here on what is safety planning. So when families must opt for childcare solutions that are outside of licensed centers, such as caregivers found through social media, word of mouth, or maybe a non-licensed center, maybe it's something that's not an official center, having a safety plan in place is crucial. PCS season, as I said, is upon us, and families should anticipate less care options than previously available. We are seeing many options that weren't previously full, that were already on a little bit of a shaky funding, are starting to scale back some of their operations in anticipation of that funding not being available moving forward. And so we're kind of borrowing this model of safety planning. This is something that I use frequently on the side of advocacy I do with domestic violence, but you can also pull pieces of that into this. The basic protocol can still be leveraged across the systems. And we look at it in 3 basic areas, which is assessing physical and emotional safety. We're going to be planning for reliability, and we're going to be reducing our risk where possible. Sabrina, do you want to talk a little bit about striving for safety?
Sure. So first, I'm a case manager with OCC Project. And so first, we have our response time. So if you come into case management, we have a 48-hour response time. So we try to get back to you very quickly. I think we consistently meet under that 48 hours. It's like 3 hours a lot of the time. But we will get back to you really quickly because we know a lot of these child care situations sometimes are emergent and you need help quickly. And so we recognize that and we're responsive to that. We do have a lot of resources and partner organizations we work with that we can refer you to. We will still support you as best we can within our organization, but we do have connections with other organizations and we will get you connected as quickly as possible once we kind of understand the situation. And then our background checks, we will do those for free. So if you are trying to hire a private caregiver, or that is the route you're going, and that is part of the vetting process that feels safe and lets you access safe care, and you cannot afford the background check, we are willing to do that. You'll need to come in through case management, fill out our intake form, kind of let us know what's going on, and then we're happy to initiate that background check for you so that we can really be striving for that safety.
Yes, thank you. And which if you came into case management, she would go through this, but the background checks are not foolproof, right? Yeah. So it's not always a guarantee of like absolute safety with the background check, but it is a step that can be taken in addition to some other steps that we'll go through here. The background check is, it's very similar to what you would, if you had a care.com account and you wanted to pay for a background check, it's very similar to that type of background check. There's still additional vetting needed. Okay, so let's talk a little bit about how we safety plan. So first, we want to identify our immediate concerns. And so you want to prevent yourself from getting overwhelmed. And so this is an absolute crucial step. You want to think about what is your biggest concern about your child's care right now. So is it the safety of the care? Is it reliability? Is this someone that you don't get good feelings about as far as like showing up on time or showing up repeatedly? Is it the cost? And really write those things down, like break them down so that you can see them on paper and they're no longer just sitting in your head. And that will really help you in safety planning your way down. And then identifying your timeline. We want to know how urgent is your need for care. So if this is 2 days away, we may end up, if you're with us, if you're not with us, let me talk about it as if you're not with us. You want to identify how urgent your need is for childcare. And this is important because when you look then at your safety, your immediate concerns, there might be additional steps you can take if your care need is still, 2 weeks away. You might be able to do a little bit more resource mitigation. You might be able to reach out for some additional assistance from teams, background checks, if you have additional time. So putting those two things down on paper will really help you as you work through the process of what does safe care look like. Maria, do you want to talk a little bit about just, backup options and getting that support?
Yeah. Sitting here and listening already, I feel like we're throwing around a lot of scary terms. And so I really want to level set the conversation that as parents, you're already doing this on a day-to-day basis. When you go into the grocery store, when you walk into any location outside the safety of your home, even a grandparent's home, you're just still checking, right? So you're always doing this already. This is that next element of really being very clear on what that means when, like Kayla mentioned, you're in a little bit more stressful situation, right? Your options are not readily available. You're going somewhere new where you do not have a community or friends, or whether it's like a church or a community center or even a sports team. Sometimes it's a great place to meet parents. So that's what I want to focus on. And as a parent, you're already on your way doing this. This is a more formal way to do it. And then this also demonstrates how OCCP can come alongside and partner with you when there are questions, and especially in those acute situations where the timing is tough, and I don't have any friends nearby is tough. So when it comes to your backup options, what we like to talk families through is really just starting small and then going out big. At the end of the day, though, no one's doing it alone. And so depending on the severity of the situation or where they're going or the timeline of it, some of the questions we'll ask is, okay, is there anyone else in your family? Or if you're a single parent, or if you're dual parent, so a married household, anyone on either side of the family that could come in and help for a short time to make sure that this is a safer option for you. If we've exhausted all the family resources, or even some of those immediate friends that could come travel or have offered to come visit you, getting you thinking about those things outside of just, oh my gosh, we're in crisis. So after that, the one thing I really, really encourage every single family, military or not, is you got to get to know who's around you, right? And so not only is this because you might need help one time, but it's just a good way to create community and really just add more value and benefit to what you're doing when you're moving, and having that safety net. So knowing who's next door, right? Figuring out, hey, is this somebody that I can count on in an emergency? Because the safety plan, you can apply to anything even beyond childcare. So just keep that in mind. Additionally, we've talked about family, we've talked about neighbors. So maybe it's not the neighbor next door, maybe it's somebody else in the street that you've seen, again, at a sports event or at a other activity that you're doing, whether it's a volunteer or somewhere where you're like, wow, maybe I have something in common with them. Let me take the risk and go bring them a welcome note or something, just to say, hey, we can be in this together, and test that out early. As soon as you get somewhere new, for our military families, this is when you start. It's not when you have an emergency that you go start asking for help. So my encouragement to you is today, look around, have a chat, figure out who you could ask for help from. And sometimes it's also your friends, right? So maybe you get somewhere, and whether it's in your unit or you do make a friend, and they might have somebody they've already vetted. And so that's a good place to start so that you're not starting from zero. The big thing that we've seen the greatest success in the last years is making sure that as the military member or an employer, that they understand that you are facing a challenge, right? So if it is, hey, I just got here, I'm really struggling to figure out what my options are because of the wait list, because of the quality, whatever that is, because of my schedule. Okay, this is where our leaders, we're really calling on you to have this conversation early and often, where childcare isn't something that the member has to bring to you, but as a leader, you're asking, oh, that's great, you have a family? How does that day what does the day look like for you? Your spouse is at home? Great. Your spouse is working? Great. What does that mean? What's your plan? uh-oh, your spouse gets sick. What are you doing? And so as a leader, there's all sorts of great questions that we would love to help coach you on to really be that leader that makes this part of just normal conversation and normal operations, because it is absolutely what's going to underpin our mission readiness. I think that's good, Kayla.
You did great. And there's questions that are related to what you said that did come in. And so I'll do those there at the end. Okay. So Maria, actually, do you want to talk through this a bit just on, assuming that someone goes to social media? This is something we see. Sabrina sees into case management. You saw what happens when they go, okay, well, I found this person. Can you kind of walk through, like, how do we do an assessment for this individual, especially if you haven't done something like this before?
Yes. So to level set the audience, trusted caregiver is our formal term for anybody that fits into that nanny, au pair, friend, family, or neighbor. Sometimes we've heard it as FFN in different communities. And so trusted caregiver includes all of those folks. So what we're looking at here is individuals that you are looking to provide care for your family with a certain level of trust, that we're not expecting to have the license for a school or for a building, or for even a home-based childcare. And so that's a pretty big group of folks. And so we believe this is a critical part of the full suite of options for families. And so how do you navigate that, right? Especially if you haven't done it before. Our nightmare, what keeps us up at night is when we see posts or we hear about folks that have done their best and had somebody that hey, can you watch my kids? It's an emergency, without any of these like hard questions. And so these are what we're going to ask. And you can ask yourself too. Okay, so I found this person. Well, where did I find them, right? Was it in an emergency situation? Did I post that I was super desperate and I have no family and no options? We're going to ask you those hard questions because we want to make sure that you're making the best choices that you can. And so some of the ways that we have had the greatest success and we've seen our families have success is asking friends and family, hey, do you know anyone that's taking, a gap year or is off for the summer? Or is there a teacher that you love that is looking for a summer opportunity? There is no one size fits all when it comes to the perfect trusted caregiver job or person. I think that's the one thing I've learned in the last 13 years is, man, there is all different solutions and getting really clear on what's important to you, right? Like Kaylee mentioned earlier, okay, what do I actually need? When do I need it? What are the ages of the children? Those details for your preferences and non-negotiables will really help you narrow down who that caregiver could be. The background checks, again, OCCP is willing to walk through with you on that, which is just absolutely incredible. Sometimes, whether it's on care.com or Sitter City, which is the free option for our military families through Military One Source, or we see a great success with your local Facebook groups. So in the different communities, whether it's county or even neighborhoods, there's ones that are just for nannies, babysitters, and things like that. And so you can really get a feel for what's available in your area. Some other questions going down to the emergencies, that's such an important one. Like, have they ever faced an emergency before? Or have they been, helping take care of their siblings, for example, and have never faced that, right? So we can walk through some more ideas on how to kind of learn or test that if they have been able to, and really what you want them to do, right? So some of that is being clear on your household and your family rules for an emergency, and making sure that, especially if you're hiring somebody younger, which we're seeing a lot of right now, how do we make sure they have a clear, here's my next step, go next door to the neighbor who we've already approved and we've already, can call 911 with us, for one little example. Discipline style. Yeah, this is a big one. And this is a really hard one when you're doing any of these short and quick hirings. But my personal recommendation will always be, if there's an opportunity to do a working interview where after you vetted them, before they ever see your children, right? After you've cleared that first step with you, if possible, or we work together in a way to make that happen, then seeing how they can handle it, right? And this one really goes into, this is where parents can really, really help other parents, is getting those references. Getting those calls in, they're free calls. I usually do a really respectful text if I have both the mom and dad who I can check for that person, even if it's a date night. Hey, did this person work for you? How did it go? Asking some really good questions will help delineate that, because everyone's going to present their best self to you. But sometimes when we get stressed, especially with different ages, it doesn't always go that way.
Maria, I know that this is something that we kind of talk about a little bit, especially on our helper, when we were going through our helper training. But for the people who maybe are not comfortable asking for background checks, or they think like, oh, well, that might be a little rude. Being able to dig into other things like social media to kind of get an idea, right?
Yes.
Yeah.
Yeah, I absolutely. Now, I will just say right now, parent to parent, like there is, if somebody is offended by you asking for background checks or references, red flag, red flag, red flag,
Yes.
red flag, right? And so, but you do want, you're not approaching it because you're not saying, I don't trust you, but you're saying, hey, I want to make sure I make an informed decision. And a trusted caregiver will want to be able to put their best forward and say, yeah, here, call this person. Some of the good questions are, well, why did your last job end? Or, what transition happened for that opportunity, or things like that, because those are the things that are going to help you make the best decision. If somebody doesn't want a background check, honestly, please go another direction, especially because you're paying for it. Really quick, let me put some also, just because you brought up the helper model, is if there is the time and the ability to get a first aid CPR class, that would be my high recommendation also, if we can fit that in the next 2 weeks, if you've got a little bit of time for care. But those are some of those ways you can safety plan and add more knowns into sometimes a scary situation, right? It's still scary for me to hire somebody, and I've done it a couple of times, right? I think we can all relate to that.
Yeah, and to that point, like if you don't have the time to do the CPR, if you don't have time to do the background check, and all you have time to do is a phone interview, then we're going to kind of talk about what that looks like. But that doesn't mean that it can't be in your long-term plan. So just because you can't do it in the next 6 hours when you need this emergency care doesn't mean that if you continue using that caregiver, you can't the next day say, okay, now that we've had some space to breathe, could we talk about doing some of these additional steps? I've had a trusted caregiver once not want to give me references. And I was kind of in a bind. I'd already done some other things. And so they said, well, I don't really know you that well, so I don't feel comfortable giving you references, which of course to me was like, well, of course, exactly. I don't know you that well. Right. So like, that's why I need the references. But regardless, I was already kind of in a bind, and I had a neighbor that was also available. So I was like, we'll move forward with this. My neighbor will keep an eye on as well, in case they're needed. And then that was just something we circled back to the next day of, okay, well, now that you've been here and you see I'm a real person, could I get those references before we do any additional care? So it's not always.
That's such a great example, because at the end of the day, parents, you are doing your best, right? With what you've got. And so being able to rely on those intuitions, put the pieces together. I love the idea of the neighbor being available. That's sometimes what it is, right? And so, my whole life philosophy is, how can I plan ahead to avoid emergencies? Because emergencies are going to happen all the time. And so how do we do that? Just get into this mindset of asking those good questions. Having, when we talk to families, the encouragement is, even if they do end up hiring, let's say, a nanny, an au pair, grandma, auntie, whoever that is, my encouragement will always be, let's have 1 or 2 extra babysitters that you've talked through that are ready just in case. So that when you're doing it, you're getting into that rhythm of interviewing and hiring, because it's a whole different skill set, right? That you can't just Google and just absorb it. You really get to practice it. So yeah, we love meeting families where they're at and helping them with that.
Yes. And I'm going to talk just very briefly here on non-licensed in-home care centers, whatever that might be. Essentially, it is outside of your home. You're dropping your child into somebody else's home. And if you do end up opting for a non-licensed or just non-regulated childcare center in someone's home, there's some additional questions here that you can think through. Ultimately, only you know what's best for your family. There are additional safety measures that are put into place with licensed and regulated care, but that is not to say that all unlicensed and unregulated care is not safe. It's just that you're going to have to do a little extra due diligence on your part before you decide like this is best for your child. And so here are some examples of questions. And some of this is stuff that if you have the time to tour ahead of time, to go speak with someone ahead of time, you could probably discern some of this for yourself just by looking around. How many children are in their care. They may not have to follow ratios because they're not a licensed or regulated center, but looking at your gut, if there are 5 infants and there's 1 adult, and you're going to drop off another infant, does that still feel right for you? Like, is that the appropriate ratio for supervision? Do you know any other families who've used this caregiver? Can you speak to them about this? And I think that this is important because you do not get access to background checks like you would if you were using like a licensed or a regulated center where those are publicly available. Things that you can note are their safety protocols. So fire exits. Do you see a first aid kit? Are you noticing that children are washing their hands? Like basic hygiene kind of protocols while you're in that space. You can ask them, something that we talk to families a lot about when it comes to in-home care, regulated or not regulated, is if you have a feeling in your gut that it feels a little like it's not being as monitored, like it's not as well watched, you can ask them, like, what are their policies on visitors and drop-ins? Can you as a parent drop in at any time? Mm-hmm. Do they have friends or family that just drop by on their own, on their side too?
Or older children.
Or
older children in the family.
Yeah, because you may be touring, and when you tour, it's just they're like, oh, I'm grandma, and I already watched my grandchild, so I'm going to watch your grandchild too. Do you then, through questioning or maybe stopping by on your own one day, see, oh, well, she has all of her adult grandchildren over today that are also in the room with the children? Like, if that is good with you, then it's good with you. But if it gives you a little bit of hesitation, like, ask. It's not rude to ask about these things, especially when it's in someone else's home that you're dropping your child off. Are the caregivers vetted and trained? This is going to vary. Sometimes people work in a center, and so they have some training, and then they decide it's not for them, and they'll just watch a child or two in their home. So there might be training, there might not. I think this is kind of an area where it overlaps with a trusted caregiver a bit, where it wouldn't be out of the question for you to request training if they don't have the training, especially if you're willing to help cover costs. So if they don't have a CPR certification, you could say, would you be open to that? Is that something that we could, work out in the future? Also, have you, some states, I know this is national, so keep in mind here, some states will let unlicensed or unregulated centers still register as a home. So it might be that they're watching under a certain threshold, and so they don't meet the threshold for this licensure, or maybe it's just an ad hoc. So sometimes you can look at inspection reports, or you can look at data about them, about these in-home centers that are maybe not exactly the same as, what you would get normally. And then I have a question here. What happens when a family has a complaint about a helper? What's the process? Okay, so this is actually in relation to our Homefront Help program, but I think kind of under the trusted caregiver assessment piece, we could talk about it a little bit here. So for those of you who are not familiar, Homefront Help, it is a pilot program that Operation Child Care Project runs, and we offer training. So we offer free CPR first aid, level 2 background checks, FBI fingerprint background checks. We have helpers go through additional courses that are through the state. So the Department of Children and Families has, in Florida, which is where this is live, has trainings online that anyone can take. And so we have those in the community who are already offering care to the community. They are able to participate in this and become what we call a vetted helper. It fits in nicely with this because it is a harm reduction method. That was the idea, is that we knew that families were utilizing private trusted caregivers anyway. And we were thinking, how can we make this a little bit safer for families and also give helpers support, community, and really build a trusted network for use. And so in this, when it comes to a helper in particular, helpers are not our employees. So what that means is if you reach out to a helper, you might find them on Facebook on your own, or on a sitter site, or if you come in through our case management and you're in that area, you want a helper, we'll also send an ad out. But everything that happens after that takes place between the helper and the family. So they talk about what the care looks like, what the pay looks like, what the schedule looks like. And so when there's a complaint about a helper, there isn't really a process with us because they're not our employees, and it's not a referral agency, so there's not really anything that we can do with that. What we do instead is really train families on, okay, this happened with the helper. How can we find you safe alternative care? And then how can we mitigate this moving forward? So was it that, the helper didn't get the proper training in this one area? So if it was, maybe it was swim safety, they were upset that their child went swimming within 30 minutes of eating. They had on their safety gear, but they said, I don't want my child in the pool within 30 minutes of eating. And so now they are not thrilled with the helper. Then in that case, what we would probably do is speak with the family, because the family is the ones that we're serving, and say, did you go over this with the helper? I understand that this could be an uncomfortable conversation to have. Do you need help in having the conversation? Was it demonstrated? And if all of that is true, and yes, it was done, and the helper still didn't fit their needs, it's no different than any other trusted caregiver. We would say, you need to do what's best for your family. And so if a different trusted caregiver is best for your family, then let's talk about what that looks like and help you get started in writing that ad and getting that ask out. Maria, do you have anything to add into that piece?
I will just emphasize that it's a pilot program, and that's the best part about it for us, is it's been iterative. And so we are learning with every interaction between families and helpers as we continue to think through this. And so, yeah, just always open to feedback and curious on how those things are working. But yeah, Kayla, you nailed it. I think in the future, we'll have some more opportunities to share that, just like we talked about a little bit earlier, that it's just so critical for families to talk to each other and and give those great experiences. And so I think that's really going to call on the parents to, what's best. And then we're here to support as needed.
Yeah. And to the point, I guess in a similar way, there's nothing that prevents you from checking social media. So while we don't operate a system where you can, report any trusted caregiver, that's not what we as an organization do. You can always go through social media. This is something that I think we see, for better or for worse, is that everyone seems to have a pretty heavy social media presence these days. And so if you're curious, you can always do some of that research as well. Dig in a little bit, see if anyone has used a trusted caregiver at all. And if so, if you've seen that they've responded saying, oh, I'd love to help you, you can always reach out to that family. That can be kind of one of your references. And you can ask, did you use so-and-so as a caregiver? If so, how did it go? There's ways to get creative in this, and we're happy to help you kind of navigate what that looks like also. And so let's talk. I know we're getting low on time. So just really briefly, developing a safety plan. So for families who are proceeding with a non-traditional childcare option, what we can do is help you in case management develop a personalized safety plan. And so what this looks like is first, emergency planning, who is, the closest trusted adult who can check in, neighbors, cameras, kind of like the situation I described before. We have cameras in our home. This is something that I make every trusted caregiver aware of when they step into the home, is that these are where they are. This is the purpose for them. And I'll even give them access to viewing them while they are offering the care, because ultimately they are there for our safety and for their safety. And that is something that we also tell families who sometimes think, oh, maybe I shouldn't tell this trusted caregiver that there's a camera. And I think that they would be very surprised at how many trusted caregivers are grateful that cameras are available while they are watching children. And then we can also do
on that one. And if it's a deal breaker for them, then it's a deal breaker and you just need to move on, right? Because we've seen that as well in different communities, especially the au pair community. That has been a really sensitive issue. I think just when it comes down to the ages, there's different, we all have generational things that are important to us. And so if they are uncomfortable, then you don't need to be compromising your family's plans and values based on that.
Correct. Yeah. Always trusting your gut in these situations. The next would be a check-in system. And so this is also something that I know I routinely implement, and we encourage other families to routinely implement. Is it video check-ins with the caregiver? Is it text check-ins? Do you want the caregiver to send you a photo of when your children, can you send me a photo when they sit down to eat? These are all things that are communication based. And if it gives you that ease, it makes you feel like you got a better eye on the situation, just communicate that with your trusted caregiver up front. And Sabrina, can you talk a little bit about, what would a safe exit, what do we mean when we say safe exit strategy?
Yeah. So let's say you have the cameras or you got the photo that you asked for and something's off. It's not working, right? Who is that person that you can text, a neighbor, a friend, leadership, spouse, if that's applicable? Like, who can you send a text to that says, hey, someone is caring for my kids at my house. Things are not going well, or I'm not comfortable. Can you go grab my kids and say, oh, I'm taking them on this event. We're going to the library. Like, we're all going to go to the park together. How can we safely exit this situation that that is unsafe or is not aligning with your values or what you've asked this trusted caregiver to do? What does that safe exit look like? Who can you reach out to in your network to provide that safe exit strategy for your family?
Yeah, thanks. And this is like especially true, right? When they're not anywhere near home, so they cannot be the ones who go back to the home to do that safe exit. And it doesn't have to be awkward. It doesn't have to be awful. You can absolutely call your trusted caregiver and say, oh, my neighbor's going to stop by in a minute. I totally forgot about XYZ. Yep. Thank you so much for coming over. We'll still compensate, but they actually need to grab my child. There's a way to have that conversation. And speaking of that communication, I feel like if your children are older, and I'm going to ask Maria to talk on this because she does have experience in communicating with children, as that can also be another way to do a check-in.
Yeah, this is a little bit new for us as far as a couple. So our oldest is 12. So being able to have an iPad in the house means that there's access to Wi-Fi. So for the first time, I can do a check-in that says, hey, what's going on? But for years and years and years, that was not the case. And so in those cases, you're just asking those curious questions, just like you do in other situations, and trying to kind of figure out how do they feel? How do they, what was their perception of the care or of the person? And sometimes they're, if they were holding the line, right, you said, okay, no sugary treats after lunch. And, well, they were mean. Well, okay, asking better questions. Okay, what does that mean? And so were they, that you didn't get to eat, or they followed mommy and daddy's rules? And so with the older kids, asking those good questions, because they really can, well, let's be honest, sometimes they can be part of the challenge, right? Because now they know how the household runs when you're not there. But they also have a good sense for right and for wrong in the house. And so that has been a really important part for us of short-term and long care situations, of getting their sense of the situation, because, every year you're raising them to understand what's important to your family, and it's going to be hard to compromise that. And so, of course, the big thing here is, no secrets, right? If so-and-so said, don't say anything, then that's a whole different discussion we can have. But trust your kids, and don't ask leading questions. That's the key here.
Yeah, thank you. All right, let's talk a little bit about finding support. And this is really what we're looking at, because in case management, if we do have someone coming in for a trusted caregiver and that's not their primary goal, maybe that is just something that they have to do in an interim, we will walk through those previous steps with them on everything we've already discussed. But then we start looking at, okay, what is our long-term goal then? What does this look like majorly? Or also, what if a trusted caregiver is not available? What if that is the primary option for them, but it's just not here right now? What are we going to do? So one resource that I feel like is just wildly underused is, from a military family perspective, is the local resource and referral agencies. These are people who are in your community. They know what's available, what's not available. They know how programs operate. They know where funding could be available. And as military families, we are frequently going to, militarychildcare.com, CYS, and then everything else just ends up, if I hear about it on Facebook, then I will access it. And I think that this is really like a treasure trove of information that hasn't been utilized nearly enough by military families. So you are part of the community. You can use community resources. So please, if you don't know who your local R&R is, you can go to childcare.gov. This is a linkable or clickable link. So I'll put this up on our website afterwards, and you can use that to figure out who your local R&R is, because they even know about alternative care options. I'm always shocked when I speak to someone who works at an R&R, because they're able to give me information that I never knew existed. Like, I didn't know that in some places you could get subsidized nighttime care at local license centers. Like, I didn't even know that that was a thing. So you always find out something new. I highly encourage families to check there if they haven't already. Sabrina, you are our new resident expert on militarychildcare.com. You want to talk about the MCCYN?
Sure. I do want to take a step back though and say, from a case management perspective, it's a zero judgment space. Your childcare situation is your childcare situation. It's not if Sabrina thinks it's the best choice, if Kayla thought it was the best choice, it's not my preference. It's none of that. It is what your situation is, and we are on your side to support you in whatever that choice is. How can we make it safe? How can we, if there's subsidies available, how can we get you into those? What can we do? But it's not about what I think is best. It's what's best for your family, and we're just here to support you. So I want to start there.
Preface.
As far as like the MCCYN program and the subsidies, there are childcare centers in your local community that are participating in these programs. It stands for Military Childcare in Your Neighborhood. And you can come into case management and you can ask, like, I would like a center search. That's what we call it, a center search. And I would like access into, or a list basically of all the locations in my area that are participating in this subsidy program. We can give that to you. If there are centers in your area that you just love it, like, but they're not participating in MCCYN, they have to elect to participate in it. It is not required. But if that center, you love it, and the director of that center is like, yes, I would be interested in participating in that, we can help both parties get into MCCYN, you as the family and you as the center. So there are lots of options. We are absolutely coming alongside you to do that. And sometimes maybe that is your long-term care option. Your long-term goal is MCCYN at a center in your area, but your short-term care option is going to be a trusted caregiver. We can help you with both. We see this being pieced together for lots of families in lots of different ways. Can I hit on parent networks?
Yeah,
okay.
Go ahead with parent.
As far as parent networks, like, what are you doing in the community? Where are you seeing parents? Is it at your stroller strides group? Is it at your library book club? Or is it when you go to the gym and you drop your kids off at the YMCA childcare and that mom is also taking that class with you? Like, how are we connecting with people? Where are you meeting other people? I see a lot of parents say, like, I don't want to share the name of my babysitter because I don't want them to be like stolen or taken. And like, I get it. We all want, we want our trusted caregiver that we like to be available for us, but really, like, sharing is caring. If we, who can you ask? And like, let's not gatekeep the fantastic trusted caregivers that are in our community. I think that's really, really important. And the last thing I'll say about like the parent networks is Maria and I were working with a family that, it looked like a short-term trusted caregiver was going to be their best option until they could get into the CDC. And Maria walked them through, like, this is in March and April. Okay, so a lot of colleges are like on spring break or they're gearing up for finals. Like, is there a cousin's kid who's in college who's going to be home who might be looking for some extra cash? Like, think big. Really expand your idea of not necessarily safe care, but like, where else can you ask? How else can you ask to find in these networks? Because it might not be just the neighbor next door or just the mom you saw at the workout class.
Yeah. And even if you don't know that person very well, so if it is your cousin's nephew, and maybe that's the same now that I said it out loud, I think that's still just their nephew. But regardless, you can follow the steps we've already talked about and safety plan with them just like you would any other trusted caregiver. It doesn't mean that you have to implicitly trust someone just because they're referred by a family member. You can still work through those steps.
Absolutely.
And then the federal, you're going to hear about your state and federal programs. So your Head Start, your child care assistance programs, those are going to come from your local resource and referral agencies as well. We track them within our case management, so we're able to tell families about them. But the people who know those best are going to be your local R&Rs. They're going to be the ones who have the most knowledge on accessibility, wait lists, things like that. And then last but not least in finding support, Maria, let's talk a little bit about leadership.
Yeah, we'll talk about it one more time. And so it's been so cool to partner with families who are in a acute situation, whether it's the one spouse is deployed and the other spouse is still working, or a spouse is, military member is working, but the spouse is in a medical emergency for a long period of time and things like that. So really what it comes down here is childcare is a critical part of our mission readiness in every single branch and every single mission. And it's only becoming more so with our numbers. And so this is where leadership can really come alongside, because we've seen some incredible leaders out there who have made small adjustments to a member's schedule, which actually allowed them not to need, for example, a third childcare solution for their family in that period of time, or a secondary one. And we're talking thousands of dollars because a leader was open enough to hear the member talk to them about the situation, whether the member brought it up or the leader brought it up, and is willing to have that conversation. And so we're really calling on leaders to, just because you experience something different in your career does not mean you have to be that leader today. And I present to you that our childcare landscape today in all of our military communities is far different than it was even 2 years ago. And so really just being available to have those conversations. If it's too weird and you're not sure about it, then you come into case management. We work with lots of leaders and we love that, because it really demonstrates that this person at the top of a situation is actually caring about those folks and those families. And I guarantee their unit's gonna, the performance will exactly reflect how well those people feel taken care of. Okay.
And in case anyone was wondering, Maria is near a pool. So when you hear the scream followed by a splash, it's children are not dying. They are enjoying themselves in a pool.
Yeah.
Thank you. So the last thing that I have, this was a question that came in, and I thought it was a great question. And honestly, it's something I see on Facebook a lot. So I'm going to let Sabrina and Maria answer this, but I'll give my answer first, which is, what if you are awkward and you don't know how to break into these groups to ask other parents? And I'll tell you about a really awkward way that someone did this with me once. And it's still my favorite story to this day. I guess her child and my child, they were at the same daycare center, and she had wanted to chat with me, and she didn't, and like form a relationship to have some support. She didn't have any family in the area, and she didn't know how to broach it. And so she brought me a crayon drawing and said, "My child drew this for your child. Do you want to hang out sometime?" And she handed me this paper with this like script. And in my mind, I'm like, either this child draws really well, this 4-year-old draws really well, or this woman just drew this picture and handed it to me. But either way, it worked. I was like, I mean, if you're giving me a handmade item, yeah, we can hang out. Absolutely. So I'll pass it over. Maria, what do you think is a way to break the ice when something is super awkward and you maybe you're not great at it?
That's a great question. Full disclosure, we have a couple children and more than perhaps the average. And so we're very often, doing our own thing. But because we're doing our own thing, it means like adding another child or two in the mix doesn't impact literally anything, right? It's just an easy add. And so I will always admire anybody that asks for help, especially when it comes to their most precious children. So I think sometimes your example was great, like sending home notes with the kids, right? Where it's the phone numbers. Hey, this is my mom's phone number. That really is effective. Sometimes, we have for different schools, different ages, there's group, those group chats. And so you can privately message folks without having to awkwardly ask for their phone number right away. Some folks have found me, through Facebook. So I think the key is, even if you feel you're awkward, it's so much more important and valuable to get that connection. So just take the risk.
We had only been at this location for like two weeks maybe, and my husband, like, we moved and he left 5 days later. Like, he was right out the door for training. So I knew nobody. I had little kids at the time, but I was like enrolled at the YMCA, and I saw this other mom, and I was like, we're lining up to get into class, and I was like, she looks nice. And then I saw on her water bottle she had a Colorado sticker, which is where I'm from, and we're in Texas. And I was like, that maybe that's too coincidental. Like, maybe she's also from Colorado. And so I just like kind of like eased my way up next to her, and I was like, I like your sticker on your water bottle. And she was like, thank you. And I said, are you from Colorado? And she goes, nope. And that was the end of the conversation. I was like, I'm going to have to go in for it again. And I was like, okay, so, but why do you have a sticker from Colorado?
There you go.
Like, oh, we were stationed there. Bingo. That's all I needed to know. And you know what? We ended up like sending our kiddos, our oldest, to preschool together. Like she had some health stuff that came up. We ended up being like a great support system for each other. It sucks to have to be awkward about it, but like sometimes you just have to do it. And I'll also say separately, I have one kiddo that, you know, if anybody's like, are you X child's name mom? I like the fear of God is in me because I'm like, oh my God, what happened? Like, what happened? But you know what? Like, I've had a lot of moms now who are like, they would like to have a play date. Can I just get your number? And I'm like, this is a great thing for me. But you know, you get the like, oh no, what happened? Sometimes you just have to do it. You just have to be willing to go for it.
We have to do it to build our support systems. Yeah.
Yes.
Thank you guys for sharing those. That was good. I thought that was a wonderful question. And it is something that we see a lot of is I'm too awkward to start these conversations. And I think what we've learned is it's awkward.
It is.
But let it be awkward because the end goal is more important than that momentary awkwardness that you're going to go through. Okay. So as usual, if you have any additional questions, feel free to drop them into the chats. We will be posting this live on our website. It's also going to be available on Facebook and on YouTube. And we do go back through and answer any questions that we see pop up into the comments afterwards. If you need assistance with case management, you can come in through our website or reach out through info and we'll get you to the same place. Thank everyone for coming and I'll talk to you soon.